Hi, viewers. Welcome to our channel, the CarameLLized channel, where we bring you content, uh, healthcare content, wellness, meditation. This is a channel to make each and every person reflect, get the time to relax, and please enjoy our next interview with this very dapper gentleman. So, sir, if you don't mind, please introduce yourself to the channel.
Hello, viewers. My name is Dr. Ivan Spanton. I'm a plastic surgeon based in Nairobi, Kenya.
Great. Nice meeting you, Dr. Spanton. So, can you just give us a brief background about yourself? What inspired you to specialize in plastic surgery?
Okay. I'm a Zimbabwean. I'm 39 years old, and I attended medical school in Zimbabwe from 2003 to 2009. During my training, that's when I was exposed to the field of plastic surgery. And researching more, I discovered that Africa, and Zimbabwe in particular, is a very low patient to plastic surgery ratio, and
Mhm.
that leads to a lot of suffering, especially among our patients. That's what inspired me to venture into that field.
Oh, great, great. Dr. Spanton, we just want to recognize how much we appreciate our plastic surgeons, what they do for us. We are grateful for your services. So, can you give us a little bit of your background, your educational and training background? Where did you start off? How many years did you attend? And so forth. Just,
Okay.
yeah.
So I did my undergraduate degree at the University of Zimbabwe. That will take you like 5 years. Then after that, I did my internship at Parenyatwa Referral and Teaching Hospital in Harare. Then I went on to do my residency at the University of Nairobi. That's for another 5 years. Then I also did a fellowship with COSEXA, which is the College of Surgeons, South Central and Eastern Africa, as well as a certificate in aesthetic medicine from the American Academy of Aesthetic Medicine.
Wow. Very educated man, for sure. That's
Thank you.
nice. So, doctor, um, I'm a woman, so when I'm asking these questions, so many women are curious to find out about the questions I'm about to ask you. So let's get into it. What are the most common procedures you perform, and why do you think they are popular?
Okay, the most common procedures in terms of numbers, on number one, we have liposuction, then secondly, boob lifts, then tummy tucks, breast augmentations, and Brazilian butt lifts. I just kind of have to mention that these patterns are particular to Africa,
Hmm.
especially East Africa, where I practice. If you look
Okay.
at the statistics in the States and Europe, they
Hmm.
also have their own figures based on what their clients prefer. Like, for
Okay.
instance, in the US, a lot of people do facial aesthetics, while in
Okay.
Africa, a lot of people are concerned about their bodies.
All right.
Yeah.
So what do you think there's a specific reason or it's just difference in cultures?
I think difference in cultures, and
Mhm.
also if you look at the generally speaking, our African women have more curves than European women. So you'd find like the BBL is more common in
Okay.
Europe because people are trying to get the curves that they do not naturally have as compared to the African population.
Okay. And so I often talk to other people and like watch other videos online, and I often get confused between cosmetic surgery and reconstructive surgery. I'm like, okay, what is the difference? What is this? Can you tell us more about it?
Okay. So generally speaking, the bigger motherboard is plastic surgery, but it is now constituted of arms which are the reconstructive and cosmetic, right?
Hmm.
So under the reconstructive aspect, we talk of defects. What we are aiming to do is restoring form and function.
Okay.
So they can be either, say, congenital. You are born with malformed organs like malformed ear or hand deformities, things like that.
Okay.
Or they are acquired where you get into an accident, you have a deformed nose, you have a deformed hand,
Hmm.
things such as that. That's the reconstructive arm of plastic surgery. For cosmetic now, this is a normal organ which is functioning normally, but you are choosing to enhance it, to enhance
Okay.
beauty. Someone might feel like, oh, my nose is a bit broad, I want it a bit more pointy. That is now cosmetics.
Oh, okay. Wow. Thank you for that. That's very, oh my gosh, I love this interview. I'm learning so much already, doctor. Thank you. Actually, I don't know if it's offensive to say doctor to you or surgeon. What do how do
Yes,
we
doc
address
is
you?
still fine.
Doc is still fine. Okay, doc. Um, so what should patients consider when deciding to undergo plastic surgery?
Yes, so I think that's a very important question. What patients should consider is what is motivating them to do plastic surgery, even before they decide on what it is exactly that they want. You find sometimes there's people with um, wrong motivations.
Hmm.
Ideally, you're supposed to be doing it for yourself. If, for instance, your partner is losing interest in you and you feel like having a surgical procedure
Hmm.
will rekindle that interest,
Hmm.
then maybe you're not an ideal candidate for plastic surgery because maybe after the procedure, it will not solve your problems. Yeah. So, yeah, patients really have to look at
Yeah.
what their motivation is, then realistic expectations. I mean, sometimes people bring you pictures of the hottest model in the world and say, I want to look like this,
Yeah.
which might not be realistic in as much as plastic surgeons are good at what they do. It's also within limits where we can't perform miracles. Yeah, so
Yes. Yeah. Sure, that makes sense because you these days you see people on like one of those shows, people saying they want to look like certain celebrities and stuff. So I
yeah.
get what you're saying. It makes sense. Um, so doc, how do you assess whether a patient is a good candidate for a procedure?
Okay, so depending on whether we're doing the a consultation in person or online, what we basically start with is a history. We find out, like I was saying, the motivation of the why the patient wants this. Are they on any other medication that might affect our outcomes? Have they had any prior surgical procedures before? Would they have any conditions, medical or otherwise, that will affect their recovery from our operation? Then we also ask about things such as drinking and smoking or other medications that may affect the outcomes of our surgery, and we advise them appropriately. Then we move on now to the physical examination and now decide based on what the patient wants
Okay.
if their expectations are realistic or we are able to provide the service that they need. Yeah.
Oh, okay. Wow, very organized stuff. Doctor, right now we're in Texas. We're in Dallas, Texas. And thank you very much for visiting. I appreciate you coming to visit Texas and just seeing everything. I know you are here for a business conference in California, San Diego, for a conference that lasted for about a couple of days or so. In following up with that, what recent advancements in plastic surgery are you most excited about in the near future? And how have techniques and technologies evolved over the years?
Okay. Like the whole field of medicine, it is rapidly evolving. What's it called? Specialty, especially in plastic surgery. There's a lot of innovation, a lot of research. Currently, the big things are biomedical engineering, 3D printing, where instead of using autologous tissue, that is tissue from a human being, you can now kind of print and get a specific model of what you want to use to do your reconstruction. I think if that turns out well, it will kind of change our practice and broaden the options of what we can do. There's also robotic surgery and supermicrovascular surgery, which is on the rise, and I think the future is very bright. I'm quite excited about it.
Wow, yes, it sounds bright. Um, so, what are the potential risks and complications associated with plastic surgery? And how do you prioritize your patient's safety in your practice?
Like any other surgical procedure, plastic surgery also has risks attached to it. And when you talk of cosmetic surgery, the advantage that we would have is we are not really dealing with patients who are sick. These are patients. This is elective surgery, so these are patients who are generally in good health. So all things being equal, we do not expect them to complicate. So for cosmetic surgery, complication rates are quite low. But to answer your question, generally speaking, we can divide them into anesthetic complications and surgical complications. The anesthetic complications pertain to things which can go wrong as you are being induced to go asleep or when they are reversing the anesthesia. It might happen that things can happen and might not work up. For the surgical complications, things such as wound infection, wound and those things, but we try and mitigate them by having a team. For starters, you have to make sure whoever is operating on you is a board certified plastic surgeon and they're actually trained to do what they want to do. And for us, we have a team of surgeons, nurses, and physiotherapists who've been working with each other for a long time. So that also reduces our risk of complications.
Thank you for that detailed explanation. So, okay, take for instance, a person comes through, gets their butt lift
Yeah.
or their breast reduction or augmentation. Is that right?
Yeah, yeah, sure,
Augmentation,
sure,
yes.
sure.
Um, the post-operative care. What can patients expect during the recovery process? And how do you support patients in their post operative care?
This is usually procedure specific, but I will try and just generalize and give an answer that cuts across most of the common procedures that we do. So, because these are elective cases, admission is usually for 1 or 2 days.
Mhm.
Then you get discharged. Some of the surgeries can be done on the same day in the morning, you go home in the afternoon. So your scheduled post-op visits will be on day 3, day 7, and day 14. That's when the doctor will see you. In between that, depending, say if you have had a liposuction, you get like 7 days of a lymphatic massage to help you with drainage and recovery. Then also depending on what you've had, sometimes you might need pressure garments. Say if you've had a liposuction or a BBL or a breast lift, you might need to wear a compression garment over your body and over your breasts for like 2 to 3 weeks. Then again, depending on the how extensive the procedure is, uh, you'll be back to normal physical activity in like 6 weeks. That's when you'll be fully healed. But going back to work, you can be back to work in like 2 weeks.
All
Yeah.
right. Doc, I remember having a conversation about how people don't really listen to instructions and how people can. So is that part of how you need to explain to people and help them understand? Do you have do you actually encounter people that really don't follow instructions on the post-operative care? Like, tell me what that's like and how you've dealt with it.
Well, I think most of these things will also come with experience. Sometimes you do not emphasize enough on the importance of post-op care, and sometimes you think patients have understood, yet they haven't understood. So, as part of improving our care, now we take sufficient time to explain to our patients during the consent giving process, to explain to them what the surgery entails and what would expect from them during postoperative care and what they should expect from us. So, yeah, I think it's just an issue of effective communication.
Right, right. That makes sense. So, doctor, how do you navigate ethical considerations in your practice? I know you have a practice in Kenya and you've also had experience in neighboring African countries. What advice would you give to someone considering surgery due to societal pressures?
Okay. I think the whole of the medical field is, as it was, safeguarded by the Hippocratic Oath, a field which requires a lot of integrity and being of the highest ethical standards. So we kind of try and remind ourselves that during our day-to-day interactions with patients. Regarding societal pressure or even peer pressure to do cosmetic surgery, people have to understand that reversing some of these procedures might be difficult, sometimes almost impossible. So, for starters, we do not allow people below the age of 18 to come for procedures without a guardian present. If at any point we feel that you might need a psychiatric or psychological evaluation, we refer you appropriately so that the psychologist can assess if you're of sound mind while we are making that decision before we can proceed. So, yeah, we really do take into consideration all those factors before we proceed with surgery.
Well said, Doc. Well said. Like, I am, you've painted a very good picture, roadmap, as we would say it, about what to expect, what plastic surgery is all about. And I appreciate your detailed responses. Now, in conclusion, towards our interview, Doc, there are aspiring surgeons out there. What advice would you give to medical students interested in pursuing a career in plastic surgery? And what qualities do you think are essential for a successful plastic surgeon?
Okay. I would encourage them, really, like I mentioned, the current ratio of plastic surgeons to patients is one of the lowest in Africa. So the more medical students would want to pursue that path, the better for everyone, the better for our patients. What I'll just advise them, it needs a lot of hard work and dedication. Like from what I've explained, it takes about 12 years to be a board certified plastic surgeon. So you really have to be focused, you really have to be dedicated, hardworking. I know a lot of people will look at it like, oh yeah, this is where the money is. If that's what you're looking for, then maybe and be in the wrong field. Our priority is making a positive difference in people's lives. So you have to have a lot of empathy, a lot of care, a lot of patience. Obviously, it's a rewarding field, but that is not supposed to be your primary motivation.
Wow, yes, yes. Yeah, people really want to know how fast can I make money? What can
Yeah.
I do and stuff. I mean, so Doc, do you have a private practice surgery? What do you
Oh
have
yes, we
exactly?
we have a private clinic in Nairobi, but we also have partner institutions in Tanzania, Dar es Salaam, and in Harare, Zimbabwe. And we're looking to partner some clinics in Namibia. So you can get our contacts on our website or follow us on our Facebook and Instagram pages. It's Nakai Plastic Surgery Services.
Great. And just the last question in conclusion to all this, the future of plastic surgery. Where do you see the field heading towards the next decade? What changes do you anticipate in patient attitudes towards plastic surgery?
Yeah, I think the future is very bright. It's a growing field with a lot of young people with energy and innovation coming. And because of this whole migration, social media, a lot of people, especially in Africa, are beginning to now appreciate what plastic surgery is all about. And yeah, I think in the future, the field can only grow and become more mainstream.
Oh, wow. Thank you so much, Doctor. It brings us to the conclusion of our interview. We just interviewed Dr. Spanton, otherwise better known as Dr. Mastara as well, right? And we are going to include his website as well as information about his surgery in our bio. Please follow him on Instagram. Actually, Doctor, I'll let you shout out one more time the links, the name of the ladies. He's the best. If you actually go on his Instagram page, it's just full of content, visual content that you'll get to see his work. So one more time, if you just go through it, and we'll conclude this.
Thanks a lot, Kama. Our website is www.nakaiplasticsurgery.co.ke. Then our Instagram is Nakai Plastic Surgery. My personal handle is Doc Spanton. Then, yeah, thank you.
Thank you. Bye bye.